When you look at the studies that have been published on ketamine for depression, 90-something% of them use the IV route of administration. So when people quote 75% effective, they're quoting the IV data specifically. To my knowledge, intramuscular publications, RCTs, trials and stuff, there's a little under a half dozen of them. They're smaller sample sizes, usually like 10 to 20 to 40 patients. There are, I think, one or two that are in the 50s. And the efficacy for intramuscular appears to be a little bit lower. It's still good. It's like 50%, which is still pretty reasonable treatment success rates for a modality like this. But they're not 75%. We don't have an RCT of that, so no one's going to be able to say with 100% confidence IV is always superior to IM. But what is published would suggest that the IV's got a 25% more likelihood of helping. When you go to intranasal, the data would suggest about a 40% efficacy rate. And when you go to Lozenge, the trial data would suggest as low as like 15 to as high as 30% efficacy. So it's not that these things are ineffective. It's that when you're talking about giving somebody the best statistical chance of doing well, the IV route would be the strongest contender for that from a data-backed perspective.